People who like salt and prefer their food to be a bit salty so they can really taste it. I'm bringing you this lemon to tell you that no, you don't have to use salt. Guys, you can actually reduce the salt in your food because it contains sodium, and sodium is a problem for blood pressure. But you can use lemon to enhance the flavor of your food instead. So you can make your food tangy with it, and it will give you the same flavor that salt does but without the sodium, so your blood pressure doesn't go up. Try it out and you'll find it works really well. Now, is your high blood pressure just a temporary spike like when you're stressed, as most people think? Or do you actually have chronic high blood pressure? Let's talk about that in today's video. Let's start from the beginning and discuss how we diagnose high blood pressure. What are the types of high blood pressure? What are the tests we do to assess your blood pressure, your body's condition, and to make sure you haven't developed any complications from high blood pressure? The different types of blood pressure medications, some tips on how we need to change our lifestyle in terms of eating, drinking, and exercise, and so on. And there's a very important piece of information at the end of the video about the most crucial thing that protects you daily from high blood pressure. So let's start first. What exactly is high blood pressure? Your blood pressure increases. We determine this by measuring your blood pressure. Normally, every healthy body has a maximum limit for blood pressure that shouldn't be exceeded, because when it goes above that, it starts causing complications, the most important of which are complications affecting the heart, kidneys, brain, blood vessels, and other issues. So what are the blood pressure numbers? Everyone has the number 120/80 stuck in their minds, so if it's not 120/80, if it's lower, they say my blood pressure is low, and if it's higher, they say my blood pressure is high. In the past, we used to start diagnosing or paying attention to high blood pressure when the top number reached 140. But now, we've become a bit stricter. We start paying attention when it's over 130. So when blood pressure reaches 130 or more, we start to pay attention and begin measuring blood pressure regularly to see if most of your readings are like that or not. This is to know whether we need to change your lifestyle or not, and whether we need to prescribe medication or not. Now that's for the top number. As for the bottom number, we start paying attention when it's above 85. Generally, most people don't reach these numbers with their blood pressure, but many people do reach these numbers and don't realize that this number actually needs attention, needs monitoring, needs tests, and needs a visit to the doctor. Okay, blood pressure numbers aren't fixed for all age groups. The age group I'm talking about here is the middle age, let's say from adolescence, or the start of adolescence up to the age we call elderly or seniors, which is roughly 60 or 65 years old. Because after that age, we're not as strict. We allow the numbers a bit more leeway compared to the younger age group. Now, if at some point, say, you're visiting the dentist or getting lab tests done, they measure your blood pressure and find it high, does that mean you have hypertension? Of course not. We can't rely on just one reading to say that you have hypertension. So what do? That reading serves as a warning sign. After that, you need to start monitoring your blood pressure using several options. The first option, and it's actually the best one, is a blood pressure device called an ambulatory monitor. We attach it to you for 24 or 48 hours, and it comes with a device similar to a mobile phone that stores all your readings. It stays attached to your arm for 24 to 48 hours. Its main advantage is that it measures your blood pressure while you're awake and while you're asleep. It measures your blood pressure at roughly regular intervals, let's say every half hour, and sometimes every 20 minutes, so over 24 hours. We might end up with more than 30 blood pressure readings. We measure your blood pressure while you're happy, sad, angry, calm, or even asleep. So it gives us an impression of your blood pressure readings throughout all your different states. When we come to interpret these readings, we get a more accurate picture. Is your blood pressure high at various times, or was it just that one time you visited the doctor or happened to measure it and found it elevated? The second advantage of this is that when it measures your blood pressure while you're sleeping, it draws our attention to another problem that might be happening to you during sleep. This is what we call nocturnal sleep apnea. In this condition, your oxygen levels drop and it starts to put significant strain on your heart muscle. The second option is to visit the nearest clinic or health center to you and have multiple blood pressure readings taken. It's preferable that at the time of measurement, you haven't had coffee or any stimulants. You shouldn't have smoked cigarettes. You shouldn't have eaten within about half an hour to an hour before the measurement. You shouldn't be angry or upset. You shouldn't be in a hurry or feeling rushed. So, after using the bathroom, you should be sitting with your back supported, your body relaxed, and your arm in a comfortable position. The device should be at the level of your heart, so that the reading is as accurate as possible. Now, some people might say, well, I don't have the opportunity to go to a health center, or I have a device at home and it's a digital one. In the past, we used to underestimate the importance of measurements taken by digital devices, but now that's not the case. Now, we just need you to calibrate the device at least once every 3 to 6 months. What does it mean to calibrate the device, doctor? It means you take this device and visit your doctor, you measure with your digital device and the doctor measures with theirs, and we calibrate the device. Basically, we do something like a factory reset, so we know if your device is reading 10 higher, 20 higher, 10 lower, or 20 lower, so you can be aware. How do you evaluate the readings from your own device? If you have the device, it's preferable that you take more than 14 readings over the course of 7 days, so we can also get different times. On different days, sometimes you'll be on vacation, other times you'll be at work, sometimes it will be at night, other times during the day. And as we agreed, the same conditions we mentioned apply. The readings came to us, and we found that many of them were high. Of course, we don't rely on just a few readings. We might take more than 3 different times. If the blood pressure was high in 3 or more of those times, then we can say you have high blood pressure. But we get an idea from most of your readings. If most of them are borderline and only one is high, then that makes us a bit more patient with the diagnosis. If most of them are clearly high, or if there are 3 readings that are clearly high, and the rest of the readings are borderline, we still say that there is high blood pressure, that's it. But if all the readings are good, all of them are fine, and we find only one reading that has a problem, here too, we pause and have patience before we make a definitive diagnosis, assuming that if we said the readings are high and so on, this is not just a temporary spike, you actually have high blood pressure. Are we going to start treatment right away then? No. Why is that, doctor? It could be that the high blood pressure you have is secondary hypertension. What does secondary mean, doctor? It means there is something else. That is the reason your blood pressure has increased. And for this type of blood pressure, we do tests to rule out the presence of a cause that is actually raising the pressure, like a complete blood count test, a thyroid function test, which we call TSH. We do an HbA1c test to keep an eye on things, in case you have anything else besides high blood pressure. Because some people have a profile where everything comes together as a package. You'll find their blood sugar is unstable, their blood pressure is unstable, their cholesterol is high, they smoke, and they're overweight. So, to rule out any other risks that we might be unaware of, we do an HbA1c test for you. We also do kidney function tests, which are very important, because if there's a problem there, we usually have one of 2 situations. Meaning, we have a problem that actually caused the high blood pressure, or we have a problem that developed as a complication from your high blood pressure, and we need to pay attention to that. We also run tests for certain types of minerals, because some of them can be affected by blood pressure medications, the pressure that we're going to give you. The second thing is that some mineral salts can change if your endocrine glands have hormonal imbalances, like the adrenal gland, for example. So we do an ECG as an initial step to check the heart and see how the heart's electrical activity is doing. And it's also useful for us later on to know during your regular follow-ups if anything has changed or not. Of course, we do lipid and cholesterol tests, so we can also know if you have any associated risks or not. And if there is a risk, we start a treatment plan so that it doesn't cause harm later on. There are also times when some people have a problem. We listen to the heart sounds, and sometimes we might request an echocardiogram. For some people, we might add a uric acid test, and so on. After we do the tests and make sure everything is fine, if we find high lipid levels, we prescribe treatment for that along with the main treatment. So we start the hypertension treatment. There are several families of blood pressure medications, everyone, and the choice depends on your health condition, whether you have other diseases or not, or if you have any other health issues. It also depends on the doctor's choice because your age matters. There are medications we prefer for certain age groups and others we don't. Some people look at blood pressure treatment and say, "But doctor, I'm still young. If I start medication now, I'll be stuck on it for the rest of my life." Let me tell you what the bright side is. The bright side is that since you're still young, you need to get used to taking blood pressure medication. You shouldn't stop your blood pressure medication on your own, so you can protect your organs and live your life and age without any complications. But if you stop your blood pressure medication just because, from your point of view, you don't want to get used to it, after a few years, God forbid, we start to see complications in the heart, complications in the kidneys, complications in the eyes, and even more. That's why when we start a treatment plan for blood pressure, you have to stick to it and be aware that you're taking it to protect yourself from complications. We're not just treating a number, everyone. We're treating blood pressure to protect you from its complications. There's something very important, everyone, when it comes to lifestyle. I mean, it's not just about medication. I want to tell you that to the extent that for some people, we don't start with medication right away. If the numbers are only slightly elevated, we can start with lifestyle changes, exercise, our diet, and what we drink. Now, the hardest thing about lifestyle is when I come and tell you, please stay away from stress. You're human, I'm human, and we all have stress in our lives. We're living right in the middle of stress, so it's really hard for me to tell you to avoid stress. How are you supposed to do that? We just can't. But there are some things we can do to reduce the impact of stress on your life and your health. What I'm about to say might sound like just empty talk, but it's actually realistic, well studied, and backed by research, and it's produced results for a lot of people. Many of us don't know how to manage our time, so we can't set aside time to make ourselves happy during our free time. Why free time, doctor? I don't even have any free time. Yes, you do have free time, but you're just not able to organize your schedule and your time. For example, if your job requires more hours from you, you somehow find those extra hours. But if your health needs an hour or even half an hour a day, oh, I don't have time for that, doctor. All my time is taken up by work. Guys, we do have time. We just need to organize it so you can give at least half an hour a day to your health. So what are you going to do with that half hour? You can do any kind of exercise you're able to. You could go for a brisk walk, you could run, you could swim, you could ride a bike, you could go to the gym, do Zumba at home, do exercises while sitting down. If you are severely overweight and have problems with your knees or back, the important thing is to do any kind of physical activity. Okay, the second thing is you can start doing things that make you happy. Honestly, some people like to draw. They feel happy when they draw. Some people feel happy when they listen to music. Some people feel happy when they listen to the Quran or go to church or go to the mosque. Do something that makes you happy, even if it's just once a week, because this reduces the impact of stress on your laughter and on your organs. Okay, what else, doctor? You can also adjust your food and drink to reduce things that contain a lot of salt and things that contain unhealthy fats, table salt, and pickles. Canned foods contain preservatives and high amounts of salt. What about people who eat fried foods every day at work, on the street, or at home? We can try to reduce fried foods and switch to grilled options instead. Because some people, when we tell them to stop eating fried foods, think that I'm going to tell them to eat everything boiled, like what they call hospital food. And that's not true. Guys, we can make food grilled, it tastes great and everything, it doesn't have to be fried. And something very important for people who love salt and want their food to taste a bit salty so they can enjoy it. I'm showing you this lemon to tell you that no, you don't have to use salt. Guys, you can reduce the salt in your food because it contains sodium, and sodium is a problem for blood pressure. But you can use lemon to enhance the flavor of your food. So, challenge yourself with your food. This will give you the same flavor that salt used to give you, but without the sodium, so your blood pressure doesn't go up. Try it out and you'll find it works really well. At the very least, use a quarter of the salt you used to add. If you can do without it completely, that would be great. Add lemon and use it to season your food however you like. Lemon doesn't raise blood pressure, folks, when we use it to season our food. After that, what's left is to pay attention to your regular checkups because there are routine tests we do from time to time and blood pressure measurements we take periodically to make sure the medication we're giving you is keeping your blood pressure under control. There haven't been any side effects for you because of the medication. You haven't had any complications because of high blood pressure. So please everyone, let's pay attention to the issue of blood pressure. This is a very important topic. I hope the video provided useful information for you. Please subscribe to our channel if you find the information we share helpful. Share the video with anyone you think could benefit from the information in it. And if you liked the video, give it a like and God willing, we'll make a new video where we'll talk about another chronic disease. See you soon.